Hello and welcome back to Authentically Shawna. I'm your host, Dr. Shawna Burke. Today I am joined by Dr. Alex Talaber, who is one of my personal clinicians and is a doctor of optometry and a neuro optometrist. So I'm going to have her tell you about this amazing alphabet soup she has behind her name and what all those designations mean.
Absolutely. Thanks so much for having me. It's really great to be here and speak on this field. We are a relatively niche field, so a lot of times people don't hear about us until they've gone through a brain injury or a change in their vision or a loved one has. So I'm excited to just spread the word and help educate people on what we do.
Agreed, because it took me a long time to find you. So
Yes.
I feel like how do we help spread this information? Because I think it's probably more common than most of us think. And if you are that person, okay, how do we help get you to the person or the type of care that's gonna best serve you?
Absolutely. And it is very specialized and it can be hard to find the right type of eye doctor because there are different types of eye doctors out there. I'll start with my journey and then I'll get to what all the letters mean because I think my journey highlights how it can be a process to find neurooptometry. So I always knew I wanted to be an optometrist because I've been nearsighted my whole life. So I have myopia, which means without my lenses, I can't see anything far away at all. And I have a really high prescription. So I've worn glasses and contacts since I was 8 years old. And that's how I knew I wanted to be an optometrist, just because that really changed things for me when I had my glasses for the first time. And then in optometry school, I was with mentors who treated a lot of eye diseases like glaucoma and macular degeneration, and they really encouraged me to go that route. And so I became really dove in my internships a lot with eye diseases. And then in my 4th year, while I was doing an externship, that's where we'd have a lot of hands-on experience while you're in optometry school. My cousin, who was in high school at the time, sustained a concussion cheerleading. So a flyer fell on her head and then she fell
Oh,
back and hit the back of her head. So she really had 2 impacts to her head within a very short time frame. She developed constant double vision and then sat in a dark room for 6 months, and she was in a position where she had a lot of credits, but she ended up not being able to go back to school for her last, like, 5 months of high school. So she graduated, but barely. I knew how to diagnose what she had going on, but I had no idea how to treat it. So in optometry school, we learn all about the eyeballs and not so much what's going on behind the eyes. And our visual system is the relationship between our eyes and our brain is really the controller and processor of our vision. And so then I changed my residency from ocular disease to neurooptometry and never looked back. It's been a real gift to discover it. And my cousin luckily eventually found a neurooptometrist where she lives and got some help and therapy and prism glasses, and she's doing much, much, much better. But I was really frustrated that I couldn't help her and be that solution at that time. So, in order to specialize in neurooptometry, we usually do an additional residency or fellowship. I ended up doing both because I think it's good to just always continually learn and help patients in that way. And so I did optometry is a 4-year program. You earn your doctor of optometry and then you can practice general optometry after that. So residency is optional. So I did a 1-year residency after that to specialize in neurooptometry and vision therapy. And then after that, I did a 3-year fellowship, which that's what all the letters stand for, is the fellowship training. So it's definitely a lot more academic rigor and work, but it proves that you're at a level of expertise in that particular field. The letters become extra confusing because the organization just changed their name. So I'll say both. So the letters, FCOVD is the old name for the organization. The name change is now FOVDR. That OVDR stands for the Optometric Vision Development and Rehabilitation Association. So then the F just means you're a fellow of that organization and you've gone
okay.
through written exams, oral exams, and, written exams, oral exams, and then papers showing that you've successfully treated numerous patients. This was over 10 years ago I did this, so so I don't remember how many patients, but that's why it takes 3 years because you need hands-on experience with treating brain-related vision issues. And then I do have another fellowship I achieved in research, so that's FAAO. So that's more general or vision research related.
Wow.
I did. I'm a nerd for sure.
So let's talk about the brain because I know that's such a misunderstood component. I think I'll say that in physical therapy. I'll say that probably in most fields, the brain is so mysterious, I think, to us as humans still. And so let's talk about the difference between how a optometrist looks at the brain versus how a neuro optometrist looks at the brain and how those connect with vision.
Yes. I don't know that optometrists or general optometrists or ophthalmologists, for that matter, really even think about the brain. They're really concerned with eye health and eyesight. And in reality, our eyes are essentially extensions of our brain. So our eyes have brain tissue. So really, they are examining a portion of the brain. Cranial nerve 2 is the optic nerve. So every eye exam will evaluate that nerve.
Which is why you get your eyes dilated, right? They're really looking at, yeah.
Look at the retina, all the blood vessels, and the optic nerve in the back of the eye. But really, their measure of visual performance is eyesight. So if you've heard the term 20/20 before, it means at 20 feet, you see a particular size font. And the goal for humans is 20/20 or better. And so that's where it's a very big misconception where a lot of eye doctors will say, you have perfect vision if they see 20/20, but the patient might have double vision or they might have headaches while they read. So it doesn't measure all aspects of vision. It's very important, and eye health is very important. But that's just scratching the surface of the entirety of our visual system. It's thought that about 50% of our brain is devoted to vision and visual processing, and it's the controller of our eyes and eye movements. So it's a really key component. It's also so exciting to me because we can exercise our brain and we can upregulate neuroplasticity and improve our vision.
Which I I'll say, like, from my own experiences, before I came and worked with you, I was having a really hard time with prescriptive lenses because when I would see an optometrist, their goal was to get me to 20/20, and as soon as we tried to get me there, it made me feel awful. Like, I was like, "I don't think I'm safe to walk down this hallway, let alone drive a vehicle." Me trying to accommodate this lens that's getting me to 20/20 is making me worse. And so that
Right.
was something that we had talked about, and I think probably other people could understand that is trying to get you to 20/20 isn't accounting for what's happening in your brain and your nervous system. And so that's why working with you has been such a shift because you're evaluating the way that my nervous system is accommodating a lens, and we're not worried about getting me to 20/20. That's not the goal at the moment.
Exactly. So there are different types of lens prescriptions. So there you can have the prescriptions that are for acuity or eyesight, and that's the vast majority. Many of them are overprescribed. So that means they're too strong for what the patient needs. And that's just the mechanics of time. Like there might not have been enough time in the exam room for the patient to relax their focusing, and therefore the prescription it reads out higher than it should. That's like the most common issue I see. And then the other type of prescription is what neurooptometrists do is neurofunctional lenses. So we actually are testing different parts of the visual system that are behind the eyes and the systems that are communicating to the eyes to see, okay, we know what's clearest, but what's most comfortable for the brain and what helps performance. And that takes a long time. So, that's a big difference as well between primary eye care and neurooptometry is I spend 2.5 hours with my patients for their first initial evaluation. And we actually, after we go through the refraction, which is uncovering their lens prescription, determining if they're nearsighted, farsighted, have astigmatism. And then I do a lot of eye teaming, eye alignment, eye focusing testing. And then at the end, we trial frame. So that means I build the estimated prescription, patients walk around with it. So we look at their balance. I have them read and look at the computer screen with the estimated prescription. And we trial different types of lenses like tints and prism to see if it helps improve comfort. I have a lot of patients with traumatic brain injuries who are just really uncomfortable doing daily tasks. So our goal is to try to get them as comfortable as possible using lenses as a tool.
So let's go back and talk about the brain and how the brain uses vision to help us with everyday life? Because I think that's a really misunderstood point is that our visual system is so impactful. And I mean, I sometimes have people go get their vision checked because they're not able to figure out where they are in space because I know that their eyeballs don't know where they are in space. And I think that's a really big missing component for a lot of people.
Absolutely. It's everything. So even if the vision is blurry, people can still know where they are in space or where objects are in space. Ideal is to still have good clarity, but there are a lot of other different parts of our visual system that allow us to perform. So, different parts of our visual system are peripheral vision, for example. So, being able to see your target that you're looking at in your central vision or straight ahead, but then also being aware of what's to the sides. And when we have more peripheral awareness, it's kind of a protective effect, right? So, if somebody especially playing a sport like football, if they're more aware of their periphery, they can get out of the way or they can brace themselves for a tackle. And that's much more protective than being tackled out of nowhere. If we're more peripheral, we actually are more efficient readers because we know
Mm.
exactly where we're going to look next and we're processing peripherally as well as centrally. So that's just one snapshot into periphery. And then there's depth perception, which relates to spatial awareness, our ability to know where we are relative to other objects. And then that motor output, ideally, is that our eyes are aligning together on that target. So we have motor fusion or eye alignment, and then we have sensory fusion, which is when the right image and the left image overlap to give us true depth perception. And it's really easy for people to have dysfunctions in these areas, especially with the way that we use our eyes in the modern world with lots of screens, artificial lights, and we push our visual system a lot harder than we used to. A lot of nighttime scrolling, things like that. So that we're seeing a massive increase in lens prescriptions, binocular vision issues, eye focusing issues because of the demand we're putting our visual system through. And then there's things that you can do to help calm the visual system and reduce the effects that those devices have on our vision. But I think it starts with awareness, right? It's like,
Yeah, even knowing that something is going on. Let's talk about some common symptoms that people have that would help steer them into a neurooptometrist office versus a neurooptometry versus optometry. So what are there some like hallmark signs that you go, okay, this sounds more like it's a brain something going on versus a lens issue going on.
I would definitely say looking beyond just visual symptoms, although those are a really big cue into, something's not functioning accurately in our visual system, but even just general neurological symptoms like headaches, dizziness, nausea, motion sensitivity. So a lot of times those can be assumed to be a vestibular dysfunction, but it's very common for especially a binocular vision issue or eye teaming issue, the coordination between the two eyes to trigger those types of symptoms. So the quick and easy way I differentiate that in the intake in the patient's history is when are you most symptomatic? Is it when your eyes are open or closed? Because vestibular issues are common and they can also coexist with vision issues. So it's helpful to kind of differentiate. Of course, we test vision and we do a vestibular screening in the evaluation as well, just to see if that's contributing, especially when patients have vestibular symptoms. So I always think of those, like the ones that people don't necessarily relate to vision, but
Absolutely.
can very well be visual symptoms. And then, of course, things like just reading challenges. So difficulty comprehending, it could be a convergence issue or difficulty aligning the eyes up close. That can actually impact our intake of information because the brain is using more energy just to maintain single vision throughout that task. Fluctuations in vision, blurry vision, double vision, light sensitivity. There's many more.
Yeah, those are all good signs that hey, a neurooptometrist might be a good place to start and see what's the underlying behind these symptoms.
Exactly.
Let's talk about what are like normals, right? Like what is now normal for our visual system to be able to do? Like reading, driving, being in light. Like what are some good normals that people can think about, okay, this is what's normal. Do I match this criteria, or is there something going on that I'm not even aware of?
I really use a lot of data to understand because if we just go off of symptoms alone, that just is just highly variable and people have different ways of compensating. So I have some patients who have really severe binocular vision dysfunction, but they're not even really that aware of it because they've had it for so long, or they've compensated in a way that their brain doesn't process double vision. Even though their eyes are misaligned, they suppress one eye. So they're just monocular reading, for example. If they did have double vision, they would be aware of it. Right. But there's ways that the brain can compensate and make maladaptations or poor adaptations to all the visual. It's just ways of getting through those visual demands. So we really honestly don't know until we test. But I do think that it is normal to feel tired at the end of the day, and, like, we are human, and I think that it's definitely a red flag if in the morning it's tiring to read or perform computer work, and midday is also ideally energy would be maintained throughout the day, and then gradually, some eye fatigue and tired eyes before bed and towards the end of the day is normal. Vision should be held single, clear, comfortable all day long. So I think that's a good baseline. There's things that we can do to maintain that, like taking breaks. So every 20 minutes of sustained close work, we recommend looking far. I also think, especially for people who are on a computer or devices or screens throughout their workday and even leisure time, a lot of our leisure is on there. And I feel for young single people who are like working on a computer all day and then they're on the dating apps at night, and it's just like almost and when we're online shopping, it's like almost everything is we're forced to be on a screen, which is so hard. It's like the state of things. So getting outside, going for walks with natural sunlight, especially in the morning to help upregulate the circadian rhythm is really healthy for just our brain bodies, but also our eye health.
I
So
love
things
that.
we can recharge throughout the day. Yes.
Let's talk about, I think sometimes we give aging a lot of credit. Like, oh, I'm aging, my vision is getting worse. What's aging versus a brain symptom? Because I think those sometimes sound really similar. And I think we give aging a lot of credit where it doesn't need credit.
Right. Well, I was, taught in optometry school that past the age of 40, everybody's eye focusing reduces because of aging. And then I did vision therapy when I was in my late 20s, and my vision therapist was in her 70s at the time and never wore reading glasses. So that was the first time that I was ever exposed to, wait, you can actually do things to improve the way the eyes focus. And when we're younger, so I would say 40 and younger, it's a lot easier to retrain the eye focusing system. So in vision therapy, for example, when we do eye focusing exercises, that usually runs pretty smoothly. We can recalibrate that system so the brain is communicating to the eye focusing so that we are clearing things up close, keeping it clear over time as we're doing extended close work, go to shift far, and ideally we're able to make that clear automatically. It is easier to exercise when we're younger, but in our 40s, 50s, 60s, we can still do those similar exercises, sometimes with modifications, and patients can improve their natural eye focusing. In our later years, it does require more daily practice versus if we're younger and we have an eye focusing dysfunction, it's usually treated in vision therapy after 15 to 20 to 25 sessions, depending on how severe an eye focusing deficit is. So, seeing firsthand a vision therapist who had been practicing vision therapy for 50 years and then her not wearing reading glasses and still seeing 2025 print was really inspiring to me and hopeful that you can do anti aging eye exercises. And we're just talking about one aspect of vision, that's eye focusing. I believe that eye alignment, eye tracking skills should be maintained. And then as the brain changes through aging, and for everybody, that process is different. And it really depends on their own personal health status, genetics, brain health, because our brain and vision are essentially one and the same. When the brain changes, vision can change. But I treat patients, my oldest patient was 96, and we were working on convergence, and they still improve. So it's never too late to improve aspects of vision. After someone has cataract surgery, the eye focusing exercises kind of go out the window because they replace it with a different lens material that it has no flexibility anymore. So that's one thing I will say is that those focusing exercises aren't as possible post cataract surgery, but they can still work on eye alignment, convergence, depth perception, eye tracking, eye movement skills.
Let's talk about eye training. I know that's something that you do in your practice. I know something I'm doing through your practice. Let's talk about what it is. Personally, I think like we all have the same name for the same thing, right? Like physical therapy, vision therapy, like we're all trying to get the nervous system and your brain and your muscles to be working together. So let's talk about how that looks in vision therapy because I think that like having been a clinician and then also be a patient is fun because it I see so many similarities between the two. They're really the same thing. It's how do we interact with the brain? How do we teach it something new, release our old habits that
Yeah.
our brain has figured out to compensate for us, and then bring those new habits into daily life?
Absolutely. So, a lot of times when patients have never heard about vision therapy before, I say it's like physical therapy for the eyes and the brain because
Yes,
almost everyone knows what physical therapy is.
absolutely.
But that's in the simplest definition, you know? But it's really vision therapy is a program of sessions designed to improve visual performance, treat underlying vision dysfunction, and relieve symptoms. So really that's kind of another broad definition of it, and it does involve brain retraining for better eye movement control, more accurate eye movement control, improving how the eyes focus, team, and align with a general goal of making vision more comfortable, accurate, and automatic. So we want vision to just be running smoothly and not to have to control it or think about it. As soon as symptoms start to interfere, that's the brain's way of saying, something's off with your vision right now. You actually need to take a pause to figure out what's going on. And usually that means rest, reset. And so it's a lot of vision therapy is coaching people awareness in the beginning, what to look for, then control. How to control eye movements and giving them a lot of feedback on when eyes are aligning and focusing properly. And then through repetition, practice makes permanence. So we're trying to make these brain pathways permanent and automatic.
And let's talk about your patients. Like, who are the people that you're seeing? What are some general, broad? I mean, I came in with a traumatic brain injury, so I know that's definitely a category that you see. But who are some common patients who are coming to your office and getting care through you?
There's a wide range, actually. So, concussion, traumatic brain injury are among the most common because the visual pathways in the brain are highly susceptible to injury. It's the number one system affected by concussions.
I didn't know that.
The frustrating thing to me is that oftentimes we are the last provider that a patient lands at after a concussion. Part of that is just awareness. It depends on their care team. And so that's why I appreciate this podcast a lot. I've done a lot of research in the field of vision therapy and outreach to try to educate people on just how common vision dysfunction is after a concussion. And concussions are so common because we're active. And car accidents, we most of us drive, and that's probably the most common reason I see patients. In Colorado here, of course, skiing, snowboarding is probably a really close second, and biking.
Yes.
So sports related for sure too, but it's just I think auto accidents are just so common, unfortunately. You don't have to have an impact to the head to have a concussion. Whiplash injuries also cause concussions as well. So that is a big portion. I also treat patients who've suffered from strokes. I really love working with stroke patients because they are oftentimes just not doing any of the things they previously did. So
Yes.
most of my patients are a lot of them are retired, so their main goal is to be able to read again. They're like, I was an avid reader and I can't read anymore." Like, at all. They're completely avoiding it because of double vision or discomfort or difficulty processing.
Yes.
So I teach a lot of continuing education on how to treat stroke patients because even in my field, some doctors kind of shy away from it since there is OT and speech therapy and cognitive therapy. None of those providers are very helpful for other other aspects of stroke rehabilitation, but no one knows how to treat double vision like we do or build up visual performance and stamina like we do. So I've had so many really successful stories from helping patients after a stroke. Again, vision changes following a stroke are really common because so much of the brain is devoted to vision. So it's
Absolutely.
more common than not after a stroke to have a change in vision. I have quite a few adult patients who had childhood vision dysfunctions, and we call those developmental vision disorders that were left untreated and that persisted and then even worsened in adulthood after they started their career or even in college. They started studying more and doing a lot more computer work. And then they noticed, oh, I'm having headaches or I'm having trouble getting through the day. And so they come to me because they're like, I don't really know what's going on, but I know something is going on. And I've been told by other eye doctors that everything's normal, but I know functioning normally. So that's another one. We treat a lot of children. So children with eye misalignments called strabismus or eye turns, children with amblyopia, or that means there's one eye blurrier than the other. We treat children and adults with autism to help with visual processing, and they benefit a lot from prism lenses. I'm happy to get into what that is.
Yeah, let's talk about prisms for sure.
So there's a wide array of different patients, and they come in waves too, where I'll have vertical eye turns for are the wave of the month. I've been seeing quite a few patients this month. The profile is kind of post Botox reactions. So that's been this month's wave, which is really interesting. Anything that can change our eye muscles or communications with our nerves that are around our eyes. So there's just all sorts of different COVID's another condition that can cause changes in vision as well. So I had a handful of long COVID patients, and we can help them. That's the beauty. It's like, we can treat this. And a lot of it was based on, especially with long COVID, they came in with very similar patterns to post concussion syndrome. So we knew how to treat that. So we applied those same techniques to patients with long COVID and they improved significantly.
Wow. Yeah, I haven't heard that. I've heard of other things to help with that, but I wouldn't even have even thought to send someone to a neuro optometrist for that. Thank
Right.
you, because now I
Of
know
course.
who to send them to.
Yeah, we're here. We're with brain rehabilitation. There's just different pieces of the puzzle, and
Absolutely.
so some patients need different types of therapy. Some patients just need physical therapy or as their main treatment and all they need. But a lot of times it's more complex, and so just think of us as a piece of the puzzle to overall brain functioning.
Let's talk about optimal brain health and what that looks like through the lifespan. Because I think most people don't know what normal brain health is. When I was having a conversation with another friend of mine about a different topic, but it was like you go in to see your doctor and they're like, "Is everything okay? Is everything normal?" And you say yes because you don't know what normal is. And we don't often talk about what is normal brain health. Like, what is our brain optimal levels throughout our lifespan? Because it changes.
It did this you just reminded me of a patient I saw on Monday who 7-year-old, and they especially kids, they think how they see is how everybody sees, and so they struggle with verbalizing visual challenges, so we look more at signs and behaviors in children and avoidance, especially avoidance of near work and reading. But when you ask specific questions or direct questions, so I asked this child, do you have double vision where you see two of something, but you know just one image is there? Or do you ever see where they drift like this? And it turns out he is aware of double vision all the time. And so it
Wow.
happens all ages, but I completely understand what you mean with how is everything? And it all depends on comparison baselines with concussion. A lot of times patients know, like, I was performing at this level and now I'm performing at this level. So that awareness is actually really helpful to help start to educate them on what symptoms are triggered and how to manage symptoms and ultimately rehabilitate them, ideally back to their baseline or even better. So my hope is full recovery or even better from where they were before. So, definitely getting a gauge on symptoms is helpful and asking the right questions. We do a really long, extended symptom survey. So, there's a called the brain injury visual symptom survey. So, if there's been any traumatic brain injury, concussion, or stroke, that's the symptom survey they go through. It's a long list, but asking the specific questions is helpful to know, okay, are you How often are you experiencing double vision or light sensitivity or depth perception issues or missing steps walking up and down? That goes into a lot of detail. And then we have a non-brain injury visual performance survey as well. So that's really how I ask symptoms is they do that when before they come in or right when they come in, and then we dive in to that symptom survey, and then I ask a lot more detailed questions around that and what their day-to-day is like. We also on our website have both of those symptom surveys. So if anyone
Perfect.
listening
We'll
is
link.
maybe, but they want to be asked those right questions so they know like what is normal and what's abnormal. And the symptom surveys do have score cutoffs where if it's above a certain number, then we recommend neurooptometric evaluation. But I also think that it's important to use other aspects like, okay, well, maybe their only symptom is constant double vision. That's significant enough to warrant evaluation,
Absolutely.
plus other things. And then all of our testing does have age matched norms, which means for a 36-year-old, we know that their eye focusing or eye teaming should be performing at this level. And then we compare that to wherever they landed in their testing. So there's a lot of different areas and aspects of vision that I'm analyzing in that testing to see are they functioning within an expected range, below expected, above expected. And every single one of my patients have strengths. Like it's not every aspect of vision is functioning at a low level. It's usually not the case at all. They have strengths that help hold them up. And then they have areas that are subfunctioning and that are triggering symptoms and making it hard for them to perform at work, or driving anxiety is a big one for binocular vision issues. So going back around to the symptoms, when to
Yeah.
see an optometrist, that would be another red flag is anxiety while driving.
And I hear this quite a bit is trouble with night driving. And I think that probably has a lot to do with peripheral vision, right? Because
Yes, yes.
when it gets dark, we have to really rely more on our peripheral vision. And so I think that's something that can absolutely be trained, but people don't know. And so they just go and get another pair of glasses or they don't drive at night. But I think there's these things that if you knew that there was some way to up regulate your system or train it differently, that there is a solution besides putting on a lens.
Yes, absolutely. Night driving's tricky also because I agree, a lot of central peripheral integration, but from a nervous system standpoint, it's like dark in your periphery, but then you have these bright spotlights or bright headlights. And
Yes.
so the nervous system is communicating to our pupils to tell our pupils, well, how much should I constrict? So do my pupils dilate or constrict? So it's a really hard visual environment, and especially if someone's had a concussion, because that can actually affect the pupillary pathway.
Yes.
If they're really stressed visually, they might be more in a state of fight or flight, and that actually shifts our vision for far, dilates the pupils, but then it cuts our peripheral awareness down to get us out of danger in that moment. But if that's chronic, it makes it really hard to process whatever we're trying to process, but especially night driving or in visually busy environments.
And I'm only saying this because I was that person. So I could say that that was your everything you're saying is so spot on how I was feeling. And I think it doesn't probably even necessarily take in concussion. Like I think we've all had a few falls and knocks to our head. So it doesn't take like probably even a big event. I'm sure lots of people have this without even kind of realizing, hey, when I was 12, I fell on the playground. Like I think a lot of us have
Right.
probably had a little bit of, we'll say, brain trauma just from growing up on a planet with gravity. And so I bet a lot of this,
Exactly.
you don't have to have this big event to probably have some of these things that show up probably as we age, as we're under stress, as we're under fatigue. Like all of these things tend to get heightened in our moments of being in stressful situations, not visually related.
Absolutely. And what a gift that you can take that trauma that you went through and then teach people how to overcome it and how to honor it, but then heal. So I'm just so grateful that you're spreading the word and helping people.
Yeah, well, this is working with your office has been so amazing. And so I'm like, I need everyone to know about this because I think so many people are really struggling in this aspect and they've gone to an optometrist and there's nothing wrong with that. But again, they leave with more questions than answers and they're like, well, they're telling me I'm fine and I'm not fine. It's kind of like what we're talking about, where someone tells you that you're fine, but you know you're not. And so you go, okay, like, am I really crazy? Am I making this up? Because I have felt like that for a lot of this is like, am I making this up? Am I overly sensitive? Am I am I now just making up symptoms because I need attention? Am I like, you sort of go through this list of like, why am I so special that I have all these symptoms and no one else seems to know what to do? And so, yeah, I feel like going and getting tested in your office was such a
Answers.
different experience and so many answers as to saying, like, this symptom absolutely is correlating with what you're experiencing, and this is why. And so it's just been so, so helpful to work with you and your team. And so, yeah, I
I'm so
really
glad.
appreciate it.
That's absolutely why I do what I do, what gets me out of bed in the morning. Absolutely love what I do, so it's just so beautiful to hear. I'll be flying high all weekend.
Good, good.
But, I you remind me of so many of the conversations that I have with patients where it's like I'm their last stop, their last resort.
Totally.
Like, I've seen 5 other eye doctors or neurologists, and I am still experiencing all these symptoms. And it's such a great process because there's actual test data that we can look at and examine and see, is your vision supporting what you're doing, or is it actually really interfering and making things uncomfortable? And it's not all in one's head, but it's in the brain.
In your head, and then you're like, I know it's my brain, but like, is it my brain? Is it my emotions? Is it my, you sort of go through this whole list of like, I don't know, maybe I need to go talk it out more. Maybe I need to go figure out why all of these things are impaired. So, yeah, for me personally, this has made such a big difference in my neck, right? Like, my ability to be able to see better has made my neck less under tension. And I've done so much work, I will say, like chiropractic, physical therapy. I've done so much to try to release the tension in my neck that just is there. And it doesn't matter how many times I stretch, get adjusted, like, it keeps coming back. And getting the right prescription on my eyes has really allowed my neck to relax, because I think I was having so much visual strain that my neck was trying to help me stay upright. It was trying to help me because my vision couldn't do that for me. My brain was like, I need some input. And so my neck was like, okay, well, I'm going to go into overdrive because the visual system isn't right. So it just, I would say it's like so much beyond just your eyes. It's how your body then processes what's going on, because your eyeballs are so paramount to you being able to move and relate to other objects in space.
And it's synchronized. Our eye muscles are synchronized with our neck muscles. So if there's an eye
Absolutely.
focusing or binocular vision issue or eye movement issue, we can absolutely feel it in our neck. And so yeah, my goal with your lenses was to find the comfortable prescription, the one that helped your posture. And I think that's a good cue for everybody who wears glasses out there, is if there's any discomfort, that likely means it's not the right prescription for you. And so a lot of times the eye doctor will say, well, keep wearing it. You'll get used to it. There is a 1 to 2 week adaptation period, but the best prescription, you feel great with it on. And so there are so many different parameters that go into lenses. And so that's why it does take time to figure out the exact power that the brain needs, not just the eye.
And I will say, where I think the difference between what we're doing and like traditional optometry is, you go to the optometrist with the intention of, this is your prescription for 2 years, right? Like, when you get the prescription, it's okay, this is your prescription now for the next 2 years. That's generally like, when you look at the dates, it's a 2 year time. You can keep ordering your contacts, you can keep ordering these lenses. You have 2 years, and this is what we're thinking, that your eyes are going to maintain this for the next 1 to 2 years. And what we're doing is we're using lenses as a way to help my brain accommodate differently. So every time I see you, we're changing my glasses. It's not just, this is what it is. We're using it as a way to help my brain make different choices, relax, be able to do different tasks. And I think that's such a different perspective, is using your glasses as a tool to help your brain versus, we're just putting this on so that your brain doesn't make any more noise.
It's a dynamic process, especially when you're in vision therapy and improving your visual skills. Usually the prescription improves over time and we can
Yeah.
actually reduce it. And I used to really view glasses as more of a crutch than I do now. Now I see that they are a tool that can either promote or be neutral to healing, or actually interfere with healing and be a barrier to healing. Though that's especially true if there's too much power, too much plus or minus power, too much prism. And patients are really intuitive with their vision. So they know, we all know when we put on a pair of glasses and it's too strong, we know. And so it's just finding the right power. When I change prescriptions on myself, I will tell you, I will sit with it for days before I actually fill it. Because I take
Absolutely.
time to see, does my brain really like this reduction? And so it's an art. That's where the testing is a science, and then the prescription is very much an art. And it takes time for us to figure out what's optimal for the brain. And that's why I created the practice so that I could build out that kind of time with my patients.
Let's talk about people who are aging and feel like something like isn't bad. Like, okay, I'm not having a lot of symptoms, but something is a little off. That sort of like niggling feeling that you have. How do you know when to go and seek help and care? What's the okay? Like you're on the right track. These are these like little niggling things that you're probably having. Oh, sometimes when I'm reading in the middle of the day, I'm getting a little fatigued, or kind of like the things we talk about. What are some signs that we can look for to say, okay, now would be a good time to get some intervention before something gets really bad? Because I think a lot of times we wait until something gets really awful till we're having headaches every
Right.
day. Till we're having, like I'm always curious as to like what are the little signs that we can pay attention to so that we don't have to have like a huge explosion of symptoms.
Absolutely. I would say changes in energy level, like visual fatigue, eye fatigue, if that's shifting, any amount of eye strain or headaches around the eyes, especially frontal headaches or anywhere in or around the eyes, is that's telling us something. Dry eye can also be a sign where if we are struggling with our convergent system, for example, when we do near work, sometimes people stay because they're trying so hard to maintain clarity,
Mhm.
focus, single vision. They're not blinking as regularly. And so even dry eye, or sometimes doctors call it computer vision syndrome or digital eye strain. It could
Mhm.
actually be a binocular vision issue or convergence issue. That's that inward movement of the eyes to maintain single vision or eye focusing shifts. And it's not a weakness to wear glasses. It's at the right power. It gives our brain more energy and make it easier for our brain to process vision and recall information. So I oftentimes prescribe low plus lenses for people who are doing extended near work, hours and hours and hours a day, because the plus lenses basically allow our focusing system to relax as if we're looking a little further away. So they're still having to use their focusing and maintain clarity, but it takes the edge off and it can help relax the alignment and relax our accommodation or eye focusing system. And then I'll see patients in their 40s and 50s who are motivated to optimize their vision. They're like, I know my eye focusing has shifted because of aging. How can I optimize? Because I don't want to wear reading glasses or computer glasses. Or I will wear those. I usually encourage them to have low plus as a tool for those long days of near work. But then we give them exercises to do. And that's a little different. They don't always come in every week for vision therapy, but they're given a handful of exercises they can do to help improve their convergence and improve the way that their eyes focus as ways to just every day try to rev up that eye focusing system as like an anti-aging process.
I love that.
Yeah, that's the only system that shifts significantly when we age is eye focusing. The rest, convergence, eye tracking, ideally would maintain, but sometimes we're doing so much visual work that it's stressed and it starts to fatigue. So we do need to exercise it and improve that pathway.
Which I think is so hopeful, right? It's not like you're aging and now you're gonna be blind and that's it. And good luck doing all the fun things that you like to do. And yeah, I think there's so much more out there than just the you're old, that's it.
Absolutely. Yeah, which gave me lots of hope when I met my vision therapist. I,
Absolutely.
I was so excited to hear that it was proof right there, is that she was seeing such fine print, not wearing, and she just said, every time I'm riding my stationary bike, I do my eye exercises for 5 minutes a day. And that's
I
was
love that.
enough for her to maintain that.
I love that. So I think that's another really good thing to talk about is it like vision exercises are the same as regular exercises, right? Like we prescribe regular exercise all the time. We tell people, hey, this is how much you need to do for your cardiovascular system. This is how much you need to do for your muscles and tendons. Like, so I think like that conversation also probably could include things to do for your vision and what are the anti-aging or what are the things that we can do to maintain optimal visual health throughout our lifetime. So I really hope that people get the idea that there's things that you can do to continue to help your vision through your lifetime. There is no you're aging and That's it.
Definitely. We can do this throughout life and maintain a really high level of visual performance. And other areas matter too. Good quality sleep and nutritious diet and certain supplements can help eye and brain health. And then exercise in general helps increase neuroplasticity. So patients that I have in therapy, the ones that make faster progress are usually doing those other lifestyle things. Think of it as like a learning process, and anything that upregulates neuroplasticity helps heal and improve the visual pathways too.
What are some of your favorite activities people can do for neuroplasticity?
Good question. I love exercise, and that's such a vast open space where it depends on the person's status. I mean, I think cardio as well as weightlifting spread out throughout the week is really important. I might be mispronouncing this, but yoga nidra, am I
Yeah.
saying that right? A lot of my patients who seem to be stuck in kind of that fight or flight or sympathetic dominance within their nervous system do really well with that approach. So I don't know that the activities for best balance and lifestyle always have to be pushing and exercise and active. Even yoga nidra seems to help really help regulate the nervous system. So I recommend that a lot for certain patients. I am a firm believer in good supplements because there's a lot of good research, especially with concussion and concussion recovery. Certain supplements are really helpful for brain healing and can actually help reduce headache pain and migraine pain and duration. So the best one is omega 3. That also helps improve dry eye.
Which is amazing, like, lots of benefits. One thing, lots of benefits, which is really nice instead of having to take a bunch of things, do with fish oils, I would say, right? That's the it's an oil. Omega-3 is an oil.
Yes, exactly. And it helps build a healthier tear film for us. And it's so great that it can work to help heal the brain after concussion, but also help improve dryness of the eyes because actually dry eye can be caused by concussion because it alters blink rate
Oh.
in some patients. So it's great. Yeah, that's just a great supplement in general. The dosing changes, so if someone's had an acute concussion, usually we recommend a higher dose, and then a more maintenance dose would be 2,000 milligrams a day.
Okay. And do you have a favorite brand that you like?
Yes, there's a few out there. I like Orthomega a lot. That's the company is Orthomolecular.
I take some of their supplements too, so when I walked in your office, I was
Already
like,
in the
"I
know.
know this brand."
Yes, they're just highly purified, they're digestible. I've had a lot of patients take them with good results, so they do a lot of studies too and research within their company, so
Amazing.
yes.
Let's talk about how people can find a neuro optometrist, because I know that is difficult, right? Like, I it took me a long time to find you. So how do people find a neuro optometrist? Is there a good resource that you have for people to find a neuro optometrist near them?
Yes, absolutely. So that organization I mentioned in the beginning, the OVDRA, Optometric Vision Development and Rehabilitation Association, so it's ovdra.org. They have a database where you can search by zip code. And so you could find doctors who have earned that fellowship within their area. Our practice, we do see quite a few patients from out of state, but we do require in-person evaluations. So our practice is Neurovision Therapy Institute. We're in Denver, Colorado. Our website is neurovti.com. And then we're on Instagram. So our handle is neurovti. And we're happy to just even answer questions, messages. So we get just with building that awareness, we do get a lot of questions from people, not just local. So we try to help steer people in the right direction. And I have colleagues all over the country. So a lot of times I'll know people in their area so we can help assist with that referral. Ideally, patients are referred by other providers where they don't have to figure out, okay, well, who do I need to see? So I get a fair amount of patients referred by neurologists or primary care optometrists who really they know that something else is going on. And so there's some that are doing really good work in coordinating care and co-managing care with us. And then I'd say that's about 50% of the time, and then 50% of the time people have to do their own research. Or more recently, a lot of people are like, I found out about neurooptometry on TikTok. That's become a common one. Sounds like I have those types of symptoms. So, yeah, we just are trying to spread the word because these vision issues are so common. And yeah, I think the field is just going to continue to grow and awareness will grow. And then hopefully in the future, patients don't have to struggle for years. They're able to actually get referrals sooner or they're more aware of this as an option if they're struggling with their vision.
Completely agreed. Is there anything that I haven't asked that you wanted to share about neurovision or your practice?
I think just that when you change and improve vision, it changes lives. And so a lot of times when I first see a patient, almost seeing a shell of themselves, I'm not actually seeing who their true self is. So the way that we view neurooptometry and vision therapy is in our office is healing the person and not just treating a vision condition. And I had a really hard patient over the last few months who was unable to do home exercises, a very high performing CEO, very stressed person slash work environment, and then had a really significant concussion, which is why he came in to see us. And just the first block of 10 sessions was a struggle. Then I saw him more recently after 18 sessions. So after the second block of sessions, and he was a completely different person. He was smiling, he was relaxed. He told me that the injury saved his life.
Mm.
So that's really powerful for this. I just saw such a huge transformation, and I see it very frequently where it's by the end of their journey in vision therapy, they became their true self. I was seeing who they really are. And I think that's really the power behind it. It's not just prescribing glasses or treating convergence insufficiency or amblyopia. It's treating the person and allowing them to live their best life, whatever that looks like.
And I can say that's so true for me. I feel like I had really struggled knowing like there's something going on with my vision. There's something going on with my vision. Like that is feels like such a big block that no one is able to help me resolve. And it like being able to be in my body in a different way has been so changing for me in the past few months. So I can absolutely say, yes, that is so true. If you feel like you have any of these symptoms or any of the things that we've talked about, please go see someone. Like it is so amazing to get to treat the brain through your visual system because there's not a lot there are many ways to treat the brain, but I think doing it through your visual system is such a potent way to help the brain figure out what's going on. Because I think at the end of the day, it's your brain is trying to figure out what to do. It's trying to give you clues. Your brain is trying to help you, but in the moment, it feels like I'm having all of these symptoms that are making me feel awful. And I don't know what to do about them. And so once you figure out how to work with your brain, it's like a totally different game.
Yes, and we're just so visual, right?
Yeah.
Everything we're doing most of the day is we're processing visually and of course multisensory, it's so much more complex than and beyond vision as well, but we are highly visual people. So examining it, looking at it, improving it along the way as we get older is I think a really important piece of the puzzle to functioning well.
Agreed. Well, thank you so much for joining me. I hope everyone here has figured out, okay, I could use some assistance in this direction and then now knows where to go. There all these links will be in the show notes. So thank you so much, Dr. Talaber. I really
Thank you
appreciate it.
so much for having me. This was such a fun conversation and for you to open up and share your journey and just also bringing about awareness to our field and helping patients just even think about their vision differently or people beyond patients, people thinking about vision differently is so fun and educating the different kinds of glasses prescriptions philosophy. So I had a lot of fun. Thank you so much for letting me share. And yeah,
And I'll see you soon because I'm coming up. So I
awesome.
gotta go see Dr. Talaber because she's amazing and I'm so happy to have her as a part of my care team. So
Great.
thank you.
Can't wait to see you.
You've been listening to Authentically Shauna with Dr. Shauna Burke. The information contained in this podcast is provided for information purposes only and is not intended for the purpose of diagnosing, treating, curing, or preventing any disease. Before using any products or techniques referenced in this podcast, consult your healthcare provider. Opinions of guests are their own, and this podcast does not endorse or accept responsibility for statements made by guests. Thanks, and we'll see you next week.